Hello everyone, I'm Dr. Shilpa Madhupati. I'm practicing at Dr. Shilpa Women's Clinic, infertility specialist, laparoscopic surgeon, gynecologist and obstetrician. Today, I would like to discuss about the white discharge in a female. So, what is white discharge? What is leucorrhea? White discharge is a thing which is very common in a female during a reproductive life period. That means from 16 years to till 50 years of period, the people should have white secretions, white discharge. Those are the indications of our hormonal status. So, what are the timings? Some people will have a excessive white discharge, and some people will face some sort of itching or other things. So, how to differentiate whether normally secreted white discharge or abnormal white discharge? So, first of all, I would like to clearly mention you about the normal white discharge. Normal white discharge is a thing. It will be like a sticky one, non-odorous, non-smelly, no history of no itching, no sort of smell. Along with that, it happens only at a specific time intervals, that is 2 to 3 days prior to the periods, 2 to 3 days after the periods, and at the time of ovulation. That means within the 1 or 2 days in between the cycle, like around 10th to 15th day in between. So these discharges will not have any foul smell, any sort of itching is not accompanied with that. So with this, we have to understand our body that this is the normal status. You need not take any medication for that, and you just analyze the thing. Is there any change in the color of the secretions? We just have to monitor it. The secretions are completely not there, so you have to analyze your hormonal status. Whether there is any deficiency of estrogen is going on, we have to know about it. And estrogen is the hormone which secretes the vaginal secretions from the cervical changes. Those are because of the ovarian hormones. So those are necessary for the system to for fertilization or reproduction mechanism. Also, white discharge is the technique which helps in our system. What are the abnormal discharges? People will ask, what is the normal discharge, what is abnormal discharge? People will ask. I would like to give the idea that abnormal discharge can be considered depending upon the color of the discharge, smell of the discharge, and consistency, thickness of the discharge. So, there are 3 types of white discharges. Infectious discharges. One is difference in the color of the discharge, like creamy color or watery discharge or yellowish discharge or green color discharge. Some people will have curdy white discharge. So these are the infectious pathology, infectious originated discharge, white discharge. So among them, you just need to, some people will have a foul smell along with this too. You need not, some people will have a without any discharge, foul smell will be coming from this vagina and itching over the vagina. Some people will observe in that way. So for them, clinical examination is needed. We just have to clinical examination. You just need to consult your specific doctor, so that they'll examine you and they'll tell you whether the fungal infection is there or a bacterial infection is there. Accordingly, if it is a bacterial infection, antibacterial medication they'll prescribe you, whether it is local form or systematic way, oral medication. And fungal infections are mostly locally treatable. Every medication is not needed. So for this, accordingly, to know about your as soon as you get the discharge, don't panic, just observe it, monitor the cycles, monitor the discharge, and if it is any itching or foul smelling, then you have to consult the doctor and take the treatment accordingly. Today I would like to end this topic about leucorrhea. If you have any queries regarding this, you can consult on at my center, or you can call on this number. Thank you everyone. Namaste.